More people are dying from drug overdoses today than from gun homicides and motor vehicles combined.
I was prescribed Percocet in my early 20s for my wisdom teeth, and I found my first love.
We can be the generation that ends the opioid epidemic. We can do it. Opioid crisis is an emergency, and I'm saying officially right now it is an emergency. It's a national emergency. We're going to spend a lot of time, a lot of effort, and a lot of money on the opioid crisis.
Good evening. Remember that last August, President Donald Trump calling the opioid crisis a national emergency? But today he's calling it something else, a public health emergency. There's a really big difference. If President Donald Trump had stuck to his word and declared the drug epidemic a national emergency, there would have been new federal dollars to fight the battles, like providing treatment upon demand. A public health emergency doesn't bring new dollars. It merely moves existing dollars around. The public health emergency announced today will last some 90 days, but it can be renewed for as long as necessary. Here off script, we've been waging a war on opioid and drug addiction dating back well into last year. We've had addicts, recovering addicts, and their family members, and people who are providing assistance here to share their stories. Ginger Rosella says opioids killed her son. Lynn Miller has a son in recovery right now. How did your sons get addicted to these drugs? Let's start with you.
My son got addicted after an injury when he wrecked his bicycle at age 16. And we did rehab, sober living. He even did some time in jail, had 2 years in recovery, and then re-injured himself and was re-prescribed opiates when he told the doctor he was in recovery. Pills are expensive. They ran out. Heroin's cheap. A month and a half later, my son's dead.
Right. His story is not that different from all the other stories that we've heard.
No.
Right? You're now working out there to try to save some other young people, right?
Right.
Okay. Tell me about your son. I talked to your son on the phone today. He's in Florida now. He's helping people in recovery, but he's a former addict. Is that right?
Absolutely. He started with marijuana and then went to opiates and then ultimately went to heroin because it's cheaper. My son was also revived at one point with Narcan. He's now in long-term recovery, 3 years clean and giving back and helping other addicts. But he started as a way to fit in.
Yeah. Let me ask you both this, and I don't want to pit you against the president, but you were looking for more from the president today. You wanted the big emergency because of why?
Well, because we need immediate treatment. When someone says they're ready for help, they need to be ready to go that day. You know, there's not enough beds available, you know, and so time is the essence. You know, when someone says they're ready, you have to have a place for them to go.
Okay. I talked to Tim Kraft, okay? He's in Parkersburg, West Virginia. We had talked to him earlier, and he also is a recovering addict who's now helping treat others. Talked to him today. I want you to listen to what he had to say.
One person's probably in his late 50s, and then we have people all the way down to 18. A lot of them are regular people. We have people that have great jobs that just, you know, they had to take a leave from their job to get some help. And then we have people who's actually been homeless. So as the old saying says, it does not discriminate is actually living proof here. You have people who's held down great things in their life and people who's never understood what that even means. So
have you had a chance to talk to President Trump? What do you need? What can he do for you in the ministry that you have there in treating addicts?
Man, our biggest struggle is getting support because, you know, everything we do is donation based. Our biggest struggle is getting support to fight the fight that we're fighting. So if I could speak to President Trump, I would say look into the nonprofit organizations who are out here every day sacrificing everything they have to fight this problem, and look and see how you can help those people. Because those are the people on the front lines out here rescuing people from the depths of hell every day. Those are the ones you need help. We can throw more dollars into high maintenance treatment all we want, but what about the people who are out here every day giving it everything they have, but not for a monetary gain? Those are the ones that you need to look and see, how can I get behind that organization, because they're actually making a difference.
Tim, just one more question. Is there any way we win this battle against opioid and heroin addiction without treatment on demand?
No, I don't think so. I don't think so. I don't think we do. The problem's too large where we have to get to that place.
And I'm sure both of you would agree with that. What would you say to the moms out there who are dealing with this, with the children, spouses, that sort of thing. I mean, they need help too. I mean, you can't pray, you can't will somebody into recovery. But what do you say to them? You've been there, to hell and back.
I would say to always have hope and keep talking about it. Keep offering the treatment, and hopefully, right, one day they'll be ready, because I believe recovery is possible. I wouldn't do what I do if I didn't believe in recovery. And so I would just tell them to always have hope and just to keep talking to their loved one, because there is help out there. We just need more of it.
Yeah, I love the expression, we can't afford to leave anybody behind.
Absolutely.
We can't afford to leave any life behind. Your son is doing, you know, incredible work out there. He's doing God's work, and he's bringing people from this area down to Florida because there's not enough treatment here.
There isn't enough treatment here. We have parents calling us every day looking to get their children into treatment, and we don't have enough beds available. Insurance is an issue. A lot of our people that have addiction issues don't have insurance.
Right.
And so we don't have enough beds.
And I'm sure you cringe when you hear this talk about cutting Medicaid dollars, affordable health care and all these things.
Yeah.
Yeah, it makes us sick.
Yeah,
Okay.
it really does.
Ladies, thank you very much.
You're welcome.
Let's
Thank
continue
you.
this conversation. Back in a minute.